Good morning, everybody. I'm live in almost downtown beautiful Missouri. We are a little bit rainy looking for the day. After a pretty nice sunny day yesterday, I got a lot of stuff done outside and taught my classes. This one today is going to be a little different. We've been talking about the COVID-19 alternative theories and paradigms for treatment. And then earlier this week, we talked about insomnia and sleep disturbance and what that does to your body. And then we talked about ways that you can combat insomnia and sleep disturbance over the over this pandemic thing. Okay, so today I'm a little bit, maybe not nervous, but we're going to talk about some stuff going on behind the scenes. Hi, Linda. Hi, Sarah. Okay, so yes, there's misinformation going on about COVID-19. You're only hearing what I guess the media wants you to hear and what the powers that be wants you to hear. And this particular video and what we're going to talk about today started with me watching a Z-Dog MD video from, I think, yesterday. I watched it yesterday. I don't know if he did it yesterday. However, Z-Dog, and if I destroy his name, I apologize. His name is Dr. Zubin Damania. He goes by Z-Dog MD. I started watching him about 6 years ago. He's a comedian. He's an internist, practicing physician, and he has some interesting theories. He has a lot of stuff to say. He's got millions of views on YouTube of his videos. I see him quite a bit, and I kind of ran across him by accident about 6 years ago. So here we go. And he got me thinking about what's going on behind the scenes, what you're not hearing from the healthcare system itself. So all you're hearing about is what the media tells you, and the other thing you're hearing about is the White House briefings and Dr. Fauci, etc., Dr. Birx. And if you noticed, you're not seeing a whole lot of video or interviews from physicians that are or nurses that are practicing medicine, and there's a reason. And this is what Z-Dog talked about and got me thinking. So my brain's been firing all night about this. Morning, Jean. Hey, Tom. Diane. Laura, how are you? Eileen. So here's the deal. You've heard the adage, and it doesn't really come from Hillary Clinton, although she did say it. It takes a village to raise a child, correct? Well, it turns out nobody can figure out exactly where that phrase came from or who to attribute it to, but it's an African proverb from Nigeria. So just like it takes a village to raise a child, it takes a healthcare team to take care of patients, whether that be in the hospital, whether that be in an urgent care center, an emergency room, or even in a doctor's office. It does take a team of healthcare workers. And healthcare workers, those of us that practice medicine and had nurses, good nurses, and medical assistants and LPNs and CNAs, and even the people that clean up after the messes we make in the operating room and in the emergency room, that takes that entire team. And when you're on that front line, you are faced with things that so many other people aren't faced with, specifically hospital administrators, the people that run healthcare. Okay, so here's what's going on. Medicine has changed as far as the old school style medicine. So if you think back, those of you that are old enough to remember Robert Young on, I think that was the actor on Marcus Welby, MD, in the early 70s. He was the good old family physician, and he would make house calls, and he was always there for his patients 24 hours a day, etc. And I started talking about wanting to be a doctor when I was 8 years old. And then what hit it for me was watching Marcus Welby, MD. Well, that era of medicine is over with. My parents didn't believe me until I actually went into pre-medical education at St. Louis University when I was 18, and then kind of started thinking, oh, well, he's serious. He really does want to be a doctor. My OBGYN career was sparked by a biology teacher at Rockbridge High School in Columbia who one day showed video of live vaginal birth. So this is like direct on, watching babies come out, all the interesting things to me about delivering babies. I did wind up delivering a lot of babies, maybe 5,000, but what did it for me was gynecologic surgery. All of my classmates were either passing out or throwing up in the trash can. I was sitting right in front of this video screen, television screen back then, just fascinated. I go, I want to do this. So I wound up being an obstetrician gynecologist. My residency in 1990, so I spent from 1982 to 1990 training, and then went into medicine as a practitioner, first as an academician, then a private practice doctor, and had no clue about how that was going to go. And if I would have known the changes that occurred in the 80s in medicine, I probably wouldn't have done it. And then it's just continued to get worse and worse and worse. So with the corporatization of medicine, we are finding, or Z-Dog actually says this, I'll give him credit for this. At this point in time, 2020, only 17% of medical practices are owned privately by physician leaders. So either the person, a solo practitioner, which is hard to do these days, who actually owns their practice. They've all been sucked up into the corporate medicine world. And corporate medicine basically has turned into an MBA-driven model, an assembly line model of medicine. Okay, and we'll get to that later because Z-Dog has, I think, pretty good ideas for how to fix that. And he calls it, he's calling for a different paradigm altogether in the practice of medicine. Okay, so I told you that you're not seeing doctors and nurses being interviewed by the media, really. Almost everything you hear has been written for or canned or whatever. Okay, so I'm just going to give you a few examples because what's happening is that physicians and nurses on the front lines, and this is true even before the coronavirus pandemic, just safety of patients. So what's happening is nurses and doctors that are speaking up about safety concerns and personal protective equipment and supplies that aren't available to keep them safe and their patients safe, and then the other patients in the hospital who aren't there for COVID-19 treatment safe, are being fired and being disciplined. So I'm going to give you a few examples. So I don't have a whole lot of notes. I'm just talking off the top of my head. Adam Witt, registered nurse. He is the head of the nurses union in New Jersey. He works for Jersey Shore University Medical Center. Okay. He was recently fired for speaking out about the lack of safety in the hospital. Two of his nurses were thrown to the nursing board, and we'll talk about boards here in a little bit, for disciplinary hearings. And since Adam is the nurses union representative, he took a day off from his hospital to go to those disciplinary hearings. He also posted on social media about safety concerns at his medical center. When he returned, he was discharged for taking a day off that was, I guess, unscheduled, even though he had told them, I need to go to these disciplinary hearings. And then the hospital put up like wanted posters of this guy so that everybody in the hospital knew that he was not allowed on the property. And if he was found on the property or someone saw him on the property, they were supposed to call security, and he was supposed to be escorted off the premises. Okay, all he did was post about safety concerns at his hospital and go represent a couple of nurses that also got in trouble and were scheduled to be disciplined by the New Jersey Nursing Board for speaking out about safety concerns for themselves, their patients, all the healthcare team, the COVID patients, the patients that don't have COVID. The biggest rift, it seems like right now, is in the New York City area. So you hear about the epidemic, or I guess the kind of like, I don't want to say ground zero, that sounds 9/11-ish, but the epicenter, I couldn't think of that name, epicenter in New York City. Okay, so the epicenter where supposedly all this stuff is going on, uh, the major medical centers in New York City have issued memos in either late March or early April, and they have warned, not suggested, they have warned doctors and nurses not to speak to the media. Okay? Um, and it also says if you speak to the, hi Dana, hi Rob, Stacy, Chris, Kristen, hey, Trisha, how's Weatherford? So they are subject to disciplinary action and or termination. So this is physicians and nurses. I guess technically anybody that, sorry, allergy season, technically anybody that works in the healthcare field that's on the front line that talks to the media could be terminated just for talking to the media. Well, that's a problem. I mean, the people that are doing this should be able to tell you what's going on or tell you what they think or raise concerns about supplies and PPE and keeping patients and the healthcare team safe. Okay, what is suggested in these memos that any social media posts from anybody that works at the hospital can only be, well, should only be, but what they're saying is can only be, and if you don't do this, they're going to fire you potentially. They're recommending that only positive and uplifting media posts are acceptable on social media. What people don't know when you're on social media, and of course I'm not licensed to practice medicine, however, I can speak up, I can say it. They can't do anything. I'm an independent, entrepreneurial, retired physician working as a health coach. So I don't have a license that's subject to disciplinary action. I've been down that road, and we'll talk about that later. So, so that's what's going on in New York City. So virtually all the medical centers in New York have issued that type of memo. Okay, there's a physician named Ming Lin, and this is the doctor Z-Dog was talking about, and saying it is insane what's happening to these nurses and physicians that are trying to speak up. So Dr. Ming Lin in Washington State spoke up about safety concerns during this pandemic. And he criticized his hospital on the COVID-19 response. And of course, Seattle or the Washington State area is supposedly where this entered. Okay, so he was fired fairly recently. I didn't look down each date and all that. Okay. Jonna Porter, nurse in Los Angeles, who was suspended for posting about safety concerns at West Hill Hospital. So see, I get to even name them, call them out. West Hill Hospital, Los Angeles. The media got a hold of that, threw a big storm about that, and this nurse was reinstated without disciplinary action or loss of pay. But that was the whole issue, is that she posted about safety concerns at her hospital. Okay, so here's the deal about hospitals. It's always about the spin, right? So hospital executives want to control the narrative that's coming out specifically about their healthcare system in their hospital. They don't want people that are actually doing the work talking about what's going on and what they're worried about. Okay, here we go. Mount Sinai. Their memo to all of their employees: do not respond or speak to any reporter, as well as any current or former employee of Mount Sinai. So they're even saying that doctors and nurses can't talk to each other about their safety concerns at Mount Sinai Hospital. That's lunacy. That's crazy. Idiotic. Stupid. Doesn't even make sense. Okay? So they've put up this wall, not just at Mount Sinai, but they've put up this wall between hospital executives. So if a nurse or a physician has a concern and has an inquiry, this is a problem, how do we fix it? All of those inquiries are being sent to human resources. Okay, so you don't get to talk to the CEO. You don't get to talk to, and even probably, I'm guessing, I don't know this, even the physician executives. So there is a way to become a physician executive and get a master's degree in medical management from the there's a healthcare executive group. I've taken like 3 of their courses headed that way. So there are physicians who used to be clinicians who are now administrators, and I've watched them do this. They are good clinicians, they become hospital executive physicians, and they change. I can't get my fingers, so they flip, they change. Okay, so they become management. Okay, so there's the disconnect. Management versus the actual healthcare team that's doing the work. Okay, in Mississippi, 3 doctors and 1 nurse fired. 2 of them in Oxford. There's a nurse and a physician, Northern Mississippi Medical Center that's involved. So 3 doctors and nurses, 1 nurse fired for speaking out about safety concerns at their hospital. Okay, so the corporate medical takeover is complete. 17%, there's only 17% of doctors that are private practice. They own their practice, or a group of physicians own their practice. Oklahoma, believe it or not, is kind of unusual in the fact that the Surgery Center of Oklahoma is led by a physician who started it. They have transparent pricing. It's all done based on clinician and healthcare team management decisions. Community Hospital in Oklahoma City is also physician-owned. Very well small hospitals, but the big corporate, big box type of medicine rules, even in Oklahoma City. Okay, so I talked this Christmas to a guy that spent his entire career as a healthcare administrator. I don't think he was a CEO, but he was an administrator. Just hanging out. He retired in 2006. So that's even 14 years ago. He told me the medical management model of corporate medical America. And he said the basic model to physicians who are employed, and I've done that. I quit in 2008, I quit being an employed doctor. But he said the management model is to physicians, get the patient in the office, write them a prescription, get them out the door, and don't get us sued. That's corporate medicine. So any physician that is owned and operated by whatever health care system you want, that's the model. And we're going back 14 years ago, so it's just gotten worse. Now you've got doctors that spend their entire time clicking through boxes on an electronic medical record to make sure that maximum payment can come into their system. So what goes on behind the scenes is probably 50% of what nurses and physicians do. They're clicking and doing computer work, et cetera, prior authorizations, dealing with health insurance, dealing with Medicare and Medicaid. So it's a problem. The disconnect, especially with the requirement in 2015 that all physicians, if they want to get Medicare reimbursement, have to use an electronic medical record, has led to this huge burnout of physicians, is what the term is. Pamela, a friend of mine in Oregon, calls it physician abuse and nurse abuse and basically healthcare worker abuse. So physicians now have a suicide rate that is kind of the highest that it's ever been. So she talks about this, blogs about it, helps people do independent practice, etc. And this rise. So ZDOG is talking about the electronic health record being the kind of the impetus or the racehorse that's dragging physicians into burnout, or what Dr. Weibel would say is abuse. Okay, a friend of mine, I won't name her, started working for Integris a few years ago as an employed physician. Integris in Oklahoma, believe it or not, is the 5th largest healthcare system in the United States. In that kind of small populated state overall, it is the 5th largest hospital corporation. She started working for them, and she resigned because she kept being told, why do you keep trying to figure out what's wrong with patients? Just write them a prescription and get them out. Keep your numbers up. So diagnosing, they didn't want her diagnosing or fixing or treating or curing anybody, so she left. She started her own practice. She's doing fine. Okay, so it's doable, but it's hard to do. Most doctors that remain independent don't take insurance. They're direct primary care doctors. So I wrote article for Kevin MD about almost 4 years ago now that got kind of sent all over the place about it's called The Beauty of Direct Primary Care, or the direct primary care physician, where if you if you want to not be put in a big box or into a protocol or into what corporate medicine thinks that you should do, and actually work with your doctor and have a relationship, you have to direct pay a physician and just ignore your health insurance and submit that for reimbursement. Most of the time you get your money back. People don't know that, or they won't do it. So direct primary care is really the only way to have a really good physician-patient relationship anymore. Okay. Corporate America, to employed physicians and nurses, say, do what we tell you to do as we say, or we'll just hire someone who will. So nurses, physicians, MAs, LPNs, CNAs are looked at as commodities. So you're a commodity, and even patients are a commodity. So going back several, even when I was in Omaha, doctors that were under corporate employment agreements would come to their office someday, or one morning, because they had not done what they were told, to find chains on the front door of their practice. They couldn't get in. Well, with that, the patient records, demographics, the patient's names, all that is considered owned by the corporation. So commodities. So patients are commodities. Their medical records are commodities. The people drawing your blood are commodities. Labs that have to be done through the hospital where you work or the healthcare corporation where you work, those are all commodities. All the equipment is commodities. Everything in the office is owned by the corporation. If that doesn't work, and you continue to throw a fit like I did, they will throw you to a medical or nursing board. And then the draconian measures of a medical and nursing board investigation start. There is always something a board can find to discipline a physician, either or a nurse. And nursing boards are horrifying. Medical boards are horrifying as well. Multiply that for a nursing board. Nursing boards eat their young. I know nursing students that during nursing school went to a nursing board meeting and dropped out of nursing school saying, there is no way I'm going to subject myself to that kind of inquiry and personal violation of my freedom, and my entire life is subject to investigation by a medical board or a nursing board. They troll your Facebook. Oklahoma Medical Board trolled my Facebook during divorce. I got in trouble for providing medical advice to to my wife. And if you provide medical advice, or let's say, and every doctor I know has done this, well, I wrote a prescription for my husband or my wife or my child for a urinary tract infection, or a yeast infection or whatever, that makes you a physician. That they are your patient, and if you have a sexual relationship, which not every married couple does, that's considered sexual misconduct. Okay, so doctors can't go get mental health. I know a guy that was on 5 years probation from an academic medical center because he went in for treatment for depression. That made him an impaired physician. Alcoholic or addiction doctors that try to get help and take care of themselves get in trouble with boards. I know a doctor in Oklahoma that drives an hour and a half to go get mental health counseling under a fictitious name and pays cash, doesn't use her insurance because she's afraid of getting in trouble with the medical board and getting her license probated. If you get a probated license, your career is over. It happened to me. And eventually they'll just revoke you if you don't do what they say. Okay, so now, so medical boards is the last tenet for corporate America, corporate healthcare systems to actually go after doctors and nurses who won't toe the line. I think Z-Dog probably isn't going to get in trouble. He does speak out and he talks about ridiculousness of the medical care system, but he is also an internet phenomenon. So if Z-Dog got fired, I think he's independent, but if he got or not fired, but if he got in trouble with a medical board, it'd probably be a bigger deal than me or the 700 other doctors in Oklahoma who are well-trained and safe doctors who can't practice because of medical board action. If you multiply that across states, there are thousands of physicians and nurses who are well trained, passed their boards, passed their exams, available to help with this crisis, and they cannot do it because of licensure issues. So we have doctors and nurses that are dying from this. There's nobody to replace them. It'll be interesting to see going forward how that goes, because there's tons of doctors running around that would work, but they can't because of board actions. Okay, so ZDogg talks about Healthcare 3.0. He's been talking about this since 2016. So take the Marcus Welby model of good physician-patient relationship, where you work with a physician and they know your family, they know your children, they work with you to come up with strategies for your health care that fit with your mind model and what you're willing to do. Okay, he calls that a paternalistic attitude, and there was some fraud and abuse involved with that. And I've known personally doctors who did stupid things that were criminal and wound up in prison for that. So he's saying we don't need to go all the way back there, but he calls what we're in right now Healthcare 2.0, where and I wrote an article about this. The last time I saw my family physician in Oklahoma City, she never even looked at me. She did listen to my heart, lungs, all that, and she wrote my prescriptions, but the entire time she was interviewing me or taking my history, she had her back to me while she was clicking through her electronic medical record. Okay, so I said, my title was, Do You Miss Your Doctor? So doctors now they're doing all this stuff to fulfill these things that have nothing to do with patient-physician relationships. So ZDogg is saying, well, let's do science-based medicine. Let's bring back the physician-patient relationship as the primary focus, the patient. So what's gotten lost in this whole system is the patient. And then that relationship with the patient with their physician. So he's like, he says, let's bring this back. Let's use some of the electronic record for actual legibility. Lots of electronic medical records don't talk to each other. So even though you have a medical record, there's usually no paper anymore. In order for another doctor to look at that can't happen. As a health coach, I collaborate with doctors, and of course I can't get into their electronic medical record because I'm not an employee, nor am I a licensed physician. So if you put all that together and create a healthcare team where every member of that team is as important as any other member, then you have a healthcare 3.0 going forward. And instead of telling doctors and nurses, you can't talk about things, if the healthcare administrators refuse to acknowledge the importance of actual clinician, nurse, and patient interaction, they get fired. They're gone. So ZDogg's talking about clinician-led hospitals and healthcare systems instead of assembly line and MBA-led hospitals and healthcare systems. Okay, physician executive, because like I told you, they do flip. They become administrative and managerial. Most of them have had clinical experience, not all of them. But at least if you took a physician who actually maybe practices half-time or 25% time, is still in the realm of clinical medicine and help manage the hospitals and the healthcare systems, that's Healthcare 3.0. And then the team-oriented approach from ZDogg MD, and me, actually, I kind of did this when I was in practice, is that you have available to you a physician, a nurse, a counselor, a physical therapist, a nutritionist, a physical fitness guru, or someone to help you put together a plan of health care and disease prevention. That's Healthcare 3.0 from ZDogg. What we practice right now is pharmaceutical-based disease management, or what he calls sick care, as opposed to preventive medicine, which keeps you, and this is what health coaches do, keeps you from having to see a doctor in the first place. So ZDogg is fine with that. He goes, we should have a preventive health strategy so that you don't have to see a doctor unless you're really, really sick. and getting you off a lot of the pharmaceuticals and the medications that don't really treat anything. You're just managing symptoms. Okay, I've told you before that you can reverse type 2 diabetes. I've done it for 20 years. I've taught people how to do it. I put up a client testimonial this morning for a lady that I've worked with for about 6 months, and she wanted to do this. I told her send me pictures. She did, and I said, well, write up your experience, and she did. Okay, so she was headed for type 2 diabetes. She reversed it. She's lost 50 pounds since Thanksgiving. I started working with her the last week in November. Okay, so what we're talking about is a healthcare system that is service-based and relationship-oriented around patients, healthcare, and preventing chronic disease. And shout out to Z, part of his team is a health coach. So functional medicine doctors usually have a health coach, a dietitian, a nutritionist, physical fitness. They have LPCs, licensed professional counselors, if not psychologists, all available to you to keep you from having to get into the hamster wheel of corporate medical America. Okay, so that is my thoughts for the morning. Hope you learned something, and hope we got you thinking about something. Okay, I'll see you again Monday morning. We'll go back to me teaching some stuff instead of giving you my thoughts on the status of healthcare going forward. But I'm on board with ZDog MD. Look him up. You can find him easy. It's simple. He's got lots of thought-provoking things to talk about. Peace and health to you all. I'll talk to you Monday. Bye.